The fourth category I would like to talk to you about is telehealth. When you visit the doctor's office through telehealth, this is for when you're not in office. This is a non-in-office visit. For example, it looks like this. That's known as telehealth. It has become very popular during the pandemic. And the reason why is because during the pandemic, to keep everyone safe and social distancing and so forth, people were staying at home, seeing their doctors through telehealth. And so the government and the CDC has encouraged private insurance companies, Medicare and Medicaid, to continue doing so forth with this and continuing to cover those costs through December of 2024. So telehealth is still in effect. And everyone has been on board and has committed to continue to provide that option for those who prefer telehealth as opposed to going to the office. Now, when we talk about private health insurance or Medicaid or Medicare, you have to find out because it depends on what state you're in and what insurance company you have. So please check to find out which authorizes telehealth or not, because some do not. Now, for those of us in the deaf community, if we're going to do telehealth, we need interpreters. Of course we do. And that can be arranged. However, we know that the medical facility is required to provide an interpreter. So therefore, the ADA is still in compliance during telehealth sessions. So if you're deaf or hard of hearing, they can contact an interpreter, make sure that they're there for that appointment at the telehealth. It is important that you advocate and tell the doctor that once they secure an interpreter, they have to provide that link to the interpreter. Therefore, the interpreter will also be remote in their home or anything, and they will have access to join you and your physician at the telehealth conference. Now, this telehealth portal that they use is usually a portal that's used by the medical association. It's a large software system that they use where they maintain your medical history, your background, and your medication and so forth. It's built into the same system. And that system that holds all that information is the same system that allows them to have face-to-face meetings between doctor and patient. They can also bring in a third person, such as the interpreter, so that your access to this telehealth meeting will be accessible to you as a patient. Now, the telehealth portal in itself, when that interpreter shows up, they will only see the doctor and see you. You and the interpreter will not be able to see your medical history or medication in there because that's a separate screen that is not shared by the doctor because of HIPAA regulations. So it is important that the doctor has all this information so that they can continue with their treatment for you. So rest assured that this is not going to be exposed for other people to see. Because of the stringent HIPAA regulations, it is private. If you try to establish a telehealth meeting with your doctor and the doctor refuses to provide an interpreter, please let us know here at the Rhode Island Commission for the Deaf and Hard of Hearing, and we will help you in terms of reaching out to your doctor to advocate in terms of letting them know that the telehealth requirements of the ADA is as applicable as an in-person appointment, as mandated by the Federal Justice Department in terms of the ADA and people's rights. That has already been clearly established. So regardless of whether you're in telehealth or in person, the law applies the same. So please notify us here. You can contact me at the video phone. My video phone number is as follows. Or feel free to send me an email. And my email address is as follows. Or contact the commission, the general email, or the website, where you can enter your comments on the website. And then you can say, I need some advocates, to represent me in terms of telehealth issues. And we will respond back to you accordingly.